Hello and welcome. I'm Noelle Spears. I'm the Vice Chair for Education for the Department of Pediatrics, and I'd like to welcome you to our last Grand Rounds before a brief summer break here. We've been working hard to bring you some great speakers, and as you've seen in the slideshow, we'll have some great speakers lined up for you starting again in September. I want to take a second to thank Savannah Ryder, who's our program coordinator for Grand Rounds, who does a fantastic job helping get all these great speakers here, and our AV team, Terry McAleer, Matt, Raiden, have really done a fantastic job. We're hoping the sound is better, so give us feedback this week if it's not, and we'll keep working on that. So we have a great speaker today, Dr. Suresh, or Suresh as we all know him. He wanted me to introduce him as he went to residency fellowship and he works here, but we all know that he's much more than that. With no further ado, we'll introduce him formally. He is the Director of the Division of Health Informatics in the Department of Pediatrics. He is a professor of pediatrics and also faculty in my division, the Division of Emergency Medicine. He additionally serves as our Chief Medical Information Officer and Vice President at UPMC Children's Hospital, Pittsburgh. As the CMIO, he leads multidisciplinary teams in the application of advanced business intelligence to measurably improve healthcare for children, and his talk will touch on that today. As a researcher, he focuses on implementing robust clinical decision support tools to improve quality outcomes and control costs. He's presented and published extensively in our field. He was recently awarded the Healthcare Changemaker Award and the senior executive category by the Healthcare Information and Management Systems Society. He serves as the chair of the Council of Clinical Information Technology for the AAP and as a member of the board of the directors of the International Society for Pediatric Innovation, and is the past chair of Medical Informatics Special Interest Group of the APA. Dr. Suresh received his medical degree from the University of Madras in India. He completed his pediatric residency and emergency medicine fellowship at Children's Hospital of Michigan and his MBA from the University of Michigan. Please join me in welcoming Dr. Suresh.
Good morning, everyone. Thanks, Noelle, for the generous introduction and for the opportunity to present today. The title of my talk, ChatGPT and Artificial Intelligence, Helping Humans in Caring for Children. The title is intentional. I do believe humans should be caring for children with help from artificial intelligence. I have no financial disclosures. Given the nature of the talk, I'll be using the names of certain companies, AI tools and software, and clearly those are for illustrative purposes only, and not an endorsement of the product. The outline of this talk will start with some background, go over AI, ML, DL, and the alphabet soup, and talk about AI in healthcare, past, present, and what I believe is a glorious future. Focus on ChatGPT and large language models. There is a lot of hope and hype with those, and the applications for such tools in pediatrics in clinical care, education, research, and patient experience, and round off with some literature review. We'll start with some lingo. What is artificial intelligence? The simplest definition is replication of human intelligence in computers. This deals with the theory and development of computer systems that perform tasks that normally require human intelligence, such as visual perception, speech recognition, and decision-making. What is machine learning? Machine learning is the ability of a machine, usually a computer, to learn using large data sets instead of hard-coded rules. It gives computers the ability to learn without being explicitly programmed. Deep learning is a type of machine learning where we humans train an artificial intelligence to predict outputs given a set of fixed inputs. Deep learning software attempts to mimic the activity in layers of neurons in our neocortex where thinking occurs. And the software learns to recognize patterns similar to our brain in digital representations of sounds, images, and other data. A neural network is a computer system which is modeled on the human brain and nervous system. A little bit more lingo. ChatGPT, which is very much in the news, the GPT part of it stands for Generative Pre-trained Transformer. It is an example of what's called a large language model. So what is a large language model? It's a class of machine learning models trained in auto-completing a task. So if you have the word coronary artery as an example, these models, LLMs, may predict the next word to be disease or bypass graft or calcification based on statistical parameters learned from prior data text on how often these appear together. And these are all learning health systems, so they do get better as time evolves. These models have been growing increasingly larger, learning billions of parameters from books, articles, and conversations across the World Wide Web. And a few months ago, ChatGPT was up to 175 billion parameters. So the fundamentals, I want to go to an article which was 15 years ago, way before ChatGPT, by Professor Friedman, where he talked about a fundamental theorem of biomedical informatics, but I think that can be applied to AI and ChatGPT, et cetera. In simplistic terms, he talks about it's not human versus machine, but it is the human plus machine versus the human. And on the right side of the slide, you see that what informatics is not. He talks about how information technology can augment human reasoning as opposed to what the technology itself is capable of doing. Now, with this slide, there are two corollaries. One, informatics is more about people than technology. Number two, in order for this theorem or equation to hold, the resource must offer something that the person or the human already does not know. The metaphoric person here, the one with the brain icon, can be a clinician, a scientist, a student, a patient or an administrator, or even an organization. The information resource, the computer icon, is any mechanism capable of providing information or knowledge or advice or support to support the person's completion of a task. And the plus sign you see there is not to be read literally in the sense of mathematical addition, but to convey interaction between the human and the resource, the outcome of which is determined by what the information resource is capable of, as well as how the person elects to use it. So AI in medicine, there have been some established uses: analysis of medical images, detection of drug interactions, identifying high-risk patients, coding of medical notes, et cetera. And we'll go through a couple of examples. The latest use is the medical AI chatbot, which is where we'll be spending some time. So this was a landmark article in 2016, I think, which looked at, this was in JAMA, development and validation of a DL algorithm for detection of diabetic retinopathy in retinal fundus photographs. Over 100,000 retinal images graded by 50 plus ophthalmologists, and the algorithm was then validated and graded by 7 US board certified ophthalmologists. So in adults with diabetes, this deep learning algorithm had a 90+% sensitivity and a 98+% specificity for identifying diabetic retinopathy in retinal fundus photographs. So this was sort of a landmark article. Moving on, how did AI assist in endoscopy? This was a paper published again way before ChatGPT, where they showed a 500 times magnification view of a colorectal polyp. 300 features were analyzed against 30,000 images that were used for machine learning, predicting the lesion in less than 1 second. 250 patients were in the study, 300 plus polyps were assessed, and you can see the stats there: very high sensitivity, specificity, positive and negative predictive values with very good accuracy. So what does this do? This prevents unnecessary removal of non-neoplastic polyps, and two, also allows complete resection of adenomatous polyps, thereby decreasing colorectal cancer and cancer-related deaths. And now to a pediatric example, and thanks to my friend and colleague Sharif Rahman from Chalk Children's, who's a pediatric neurologist and an entrepreneur, and Dennis Wall from Stanford, where they looked to use machine learning to diagnose autism a little bit earlier than conventional diagnosis. And this involved short videos of children in their natural environment, crying, jumping, playing at home, and then classifying them into various buckets or categories. So the human experts came in and correctly labeled them. This increases the classification accuracy of the base model. The challenge is the need for sufficient amounts of labeled information to build the robust classifiers. And now switching on to medical AI chatbot, again, another landmark article by Patrick Lee, who directs all of research in Microsoft. So he explained this as there are two main components: a general purpose AI system and a chat interface. So ChatGPT, you see the expansion, is widely available and in active development by a company called OpenAI. All of this started in November 2022. So when we look at the pros and cons, please keep in mind, this is a technology that's not even a year old. So I think we can cut some slack there. So how do you do this? So you start a session by entering a query, which is known as a prompt. And I'll demo it in a few minutes. The response by the natural language chatbot is typically in 1 second, sometimes 5 seconds, and it's pretty conversational. The system keeps track of the context of the conversation, making it more natural and useful. This is where it is fairly different from a Google search or looking up something in Medscape or Wikipedia. And this technology is called prompt engineering. Let's go to one article before I go to actual chat GPT demo. So this was, again, very much in the news, published in JAMA Internal Medicine. Chris Longhurst, one of the authors, is a pediatric hospitalist and informatician. So he gave me some insight into this study. The hypothesis was AI assistants could potentially aid in creating answers to patient questions by drafting responses that could be reviewed by clinicians. The objective was to evaluate the ability of an AI chatbot, and this time it was ChatGPT 3.5, I think this is in November, to provide quality and empathetic responses to patient questions. The design was 195 questions were drawn from a public social media forum where a verified physician had already responded. And please keep in mind, this was not the PCP or the physician for the patient who had posed the question. So these were questions posted on a public website and a different set of physicians responded. The original question for this study was then entered into a chatbot session, and the original question and the anonymized responses were evaluated by a group of 7 physicians, including Chris, who's a pediatrician, and other internists, geriatrician, an ID specialist, and a preventive medicine specialist. So the evaluators chose which response was better, and they judged quality and empathy on a fairly simple 1 to 5 Likert scale. So the results. Evaluators preferred chatbot responses to physician responses in 79% of exchanges. The physician responses with a mean of 52 words were significantly shorter than the chatbot responses. This doesn't always mean wordier is better. So, but I guess we could talk or write more. The chatbot responses were rated as higher quality and rated as significantly more empathetic. And the stats in this article are pretty good. You can go back and look at it. So conclusion, so chatbot generated quality and empathetic responses to patient questions posted in an online forum. It can draft responses which physicians could then edit. I think this is where the key is. And randomized trial, this was not a randomized trial. This was sort of a real world data setup. Randomized trials could definitely improve upon this study. So this is on the left side, you see the quality rating. There is a lot of overlap too. So it's not like every response by a chatbot was better than every response by a physician, but you could see the overlap. But the majority of the chatbot responses from a quality perspective, as determined by physicians, felt in the good to very good category. And similarly for the empathy ratings, lots of overlap, but still you could see where on the x-axis where they pan out. So I'll just pose one question here from the 195 questions they had. The question was risk of dying following swallowing and ingesting a toothpick. So that was the physician response. Pretty direct. If this has happened 2 to 6 hours ago, this is what you do. For now, they won't be doing much. So won't read the whole thing. Chatbot response starts off with it's natural to be concerned. So it's a little bit comforting at that point. And then just if you read the first few words of every paragraph, toothpicks are made of wood. If you're experiencing any discomfort or symptoms, it's always a good idea to be cautious. So this is all generated by the machine. So what did our physician group, how did they evaluate? 100% preferred the chatbot for this response. Again, there were some which the physician response was the preferred one. And the scores, you see that 1 to 5 scale, mean quality score and the mean empathy score. So again, this study does have downsides, but I think it's a start for us to know that can AI and machines and ChatGPT just tee up things for physicians to edit and send it back, whether is this to another physician or to the insurance company or to a parent or to whoever. This is a true story from Professor Renato Sabatini's blog. He is a physiologist and an informatician and an AI expert. So this is a 3-year-old healthy female who started to regress in language and motor development, developed seizures, had an abdominal EEG. The parents went to lots of doctors. They provide different diagnoses, epilepsy, Landau-Kleffner syndrome, etc. They went to so many doctors, so the treatments also vary. She was on 8 different medications with no improvement. After 4 years, exome sequencing was done. And this is pretty expensive. The cost of it has come down, but it's still pretty expensive. A definitive diagnosis was made of Rett syndrome, a particular atypical variant. And though incurable, that variant apparently has a relatively benign evolution, survival, and symptoms. The parents were relieved. She's now receiving multidisciplinary care, doing well, including school functions, with a good recovery of many of the lost functions. So Good story. So what did Professor Sabatini do? He put this in ChatGPT. So word for word, female patient, 4 years old. You can read the rest of it. So constellation of signs and symptoms. And this is what ChatGPT put out. Based on the symptoms described, patient in question may be showing signs of Rett syndrome, which is a rare genetic disorder, et cetera, et cetera. And it sort of picks on every single word, EEG abnormalities during sleep, 4-year-old, female, regression of speech. So pretty much you probably have about 15 identifiers in just those 4 lines, what you see on the top of the input. So that's how the machine thinks. And some disclaimers also came out in the input. However, it is important to note this can be caused by other disorders, talks about diagnostic test, and gives a pretty good list of differential diagnoses. Angelman syndrome, going back to the original diagnosis, one of the original diagnoses, Landau-Kleffner syndrome, Fragile X, etc., and ends up by saying it's important to consult with the appropriate consultants. So this also got a lot of mileage. Now I'm going to the demos. Sorry, give me a second. I may need some help here, right? And I just don't see the browser. Sorry for that. So this is my a ChatGPT login. And you don't need a username password. Anybody can use it. There is also a plus version of it, which is $20 a month, and I don't have it. So I'm relatively cheap. So this is GPT 3.5. The advantage of the plus option would be GPT 4, which it doesn't mean it gives better results, but if there are newer technologies, beta versions, etc., so those can be trialed out. So I'm going to go with the GPT 3.5 and see some examples and capabilities here. So the first thing I'm doing is, okay, so this is summarizing a journal article. Validation of septic knee monoarthritis, and shout out to Desi Neville, my emergency medicine colleague, who's one of the authors here. And without going through the details, you're looking at the abstract. Most of us, when you don't have time, we look at the abstract. When we have even less time, we just look at the conclusions in the abstract, right? So that's how we read it. So here it talks about this is the objective, this is the method, this is the results. And in the conclusions, I'll read it. It says septic knee arthritis clinical prediction rule accurately distinguishes between septic and Lyme arthritis in an endemic area. That was the theme of the study. It's not very detailed. Conclusions is only 3 lines, right? And not blaming the authors here, they probably had some word, constraints or character count constraints. But what if I just take the objective, methods, and results, which I have copied here, copy it again, I'm going to ChatGPT again and saying, please, I like to put please, it's conversational, it's nice. Provide conclusions to this study. And that is it. I'm pasting it. Doesn't have to follow any particular order. So it's about 3 paragraphs of conclusions, and we don't have to go back and look at the objective and the methods and the study design, and it just lists out. And this also differs. I literally tried this an hour ago, and it gave me bullet points 1, 2, 3, 4. So something different, I may have used a different word in the prompt. So this is where the prompt engineering comes into place to use the right word. But you could see that just reading these conclusions, if the whole text of the article is pasted in or just the abstract, gives you a much better feel for what the study is, what are the limitations, and overall the study findings suggest. So, and this part of it is also not in the body of the manuscript when you go to conclusions and limitations, even if you have more time. I wouldn't say this is at a layman level, it's not, but it's probably somewhere between what the article is written for clinicians in the strength and limitations part and the conclusions part. So on the next one, I'm going to show is converting a radiology report from doctor speak or medicalese to plain English. So this is a report from a sort of a practice data set of an X-ray report, acute fracture. And again, as clinicians, we will understand it, but these days the families, the patients also get access to it pretty instantaneously. So you have words here like volar and apex and all that. So what I'm doing is copying this. Please provide layman translation. I'm still thinking, I don't know what is radius and ulna. So you can just ask that and it tells you. When you keep your hand this way, the bone right by the thumb is the radius. When you keep your hand this way, the bone by the little finger is ulna. I think it's pretty impressive. And this is very, I shouldn't say layman friendly, but it explains, it talks of, and this was a simple X-ray report. And if you think of a complex MRI report or a complex genomic report, ChatGPT is actually pretty good in they have a huge database of genomic data. So these are just some examples, and doing a time check, though, I'll come back and do some more demos of how ChatGPT can interpret, spreadsheets and providing care instructions at a alternate literacy level, and all of what I said, or most of what I said, can also be done on the phone. So the app is free to download, and if you have text to speech switched off on your phone, the output, the phone can read it back to you. So that's the advantage of having the app. Actually, I'm quickly going to show the interpretation for the spreadsheets. I'm going to ask, are you able to interpret So it is saying no. So what I'm going to do, this is just a totally made up, simplified data here, okay? This is the month, deaths in CHP, hospital B. Of course, the deaths in CHP are much lower. But I can literally copy this. Please interpret this data from Excel. And what I'm doing is I copied the columns and rows. That's not going to come up here, but it doesn't matter. We just put it like this. Now this looks like February 11th, March 24th. It does not matter. So it puts this down, and then again, the prompt matters because I may have done it slightly differently. I may have missed by one word, honestly, because it does say, please take into account the bed capacity of the hospital or any other differences between, the size and functions or patient criticality of these hospitals. It does say that. So, all right, we're going to get back to the lecture here. So this is an example of the good and the bad and back to good. So panel A is a simple conversation with GPT-4. What is metformin? So it explains what metformin is, what is it used for, etc. This was in December 2022. Human, can anyone with type 2 diabetes take it? Not necessarily, it's not appropriate, give some more explanation. And panel B is an example of an incorrect output. And human says, yeesh, that all seems complicated. I don't know what's right for me. And GPT-4, that's why it's important to work with the doctor. How did you learn so much about metformin? I received a master's degree in public health, etc. And this is real. This was in December. It does not happen today. So this is where the system learns and look it up in Google. But what can be done, so keep in mind, this panel A was correct, right? It said what metformin is. This is panel B. Now, panel C is you literally copy paste the previous 2 slides and put it back into ChatGPT. And you say, can you check this conversation between a human and an AI chatbot for errors? And GPT-4 says it appears there is an error. AI chatbots do not have personal experiences, educational backgrounds like humans do. So that is the advantage. And the error you saw in panel B is literally called hallucination. So that's a term in the AI world when these large language models, make up things. And now there's data about what is the hallucination rate, for a particular model in December and now, and it's coming down. So it learns from itself. Another example, GPT-4 and innate medical knowledge, performance of ChatGPT and USMLE. Some of you may have read this article or come across it. Evaluated the performance of ChatGPT on the USMLE exam, step 1, step 2, step 3, etc. And it did pretty good. So this is a real question. I won't go through this fully, but you get the feel of seeing some questions in our board exams, right? 12-year-old girl brought to the ED, swelling, you have some vital signs, pitting edema, urinalysis, and the question is results of which of the following lab studies are most likely to be abnormal? We have 5 choices. So word for word, this was put into ChatGPT, and the response was correct answer is C, serum C3. And it tells you, this is taken verbatim, except the underlining part, which I just put it in so we can easily visualize it. So acute post-op nephritis is the answer. So it tells you the correct choice, which is C, it's usually low, etc. And then it goes one by one, why the other 4 choices are wrong. So this is how we are trained to do board questions and increase our knowledge. So it's pretty fascinating how it goes through getting the correct answer, explanation, and then why the other 4 choices are wrong. Another technology about this is medical note taking. So this is in 2 phases. One, you need a separate technology to sort of record the conversation between the physician and the patient, and then that goes into ChatGPT. So first, informed consent is obtained for audio recording of the conversation. And here I've quoted Nuance, Drag, and Ambient Experience. There are similar tools which will record the conversation. Obviously, a lot of the examples are in adult patients in a clinic setting. With children, you have, there may be another sibling in the room, the child is crying, etc. So the ambient noise may be more in children. In this case, the transcript is then fed to GPT-4. After the encounter at the provider's request, the software will produce the note. So this is what happened. Again, I won't read it line by line, but between a physician and a patient, please have a seat. You're 20 years old. So what's the problem? Looks like some kind of eating disorder, etc. So just a complete recording verbatim done by the Dragon tool. So just page 2 of it. The clinician asks, are you feeling suicidal? And ends the conversation by saying, I'm going to do some check your electrolytes and your blood count. So this was then fed to ChatGPT. So what you see is the audio transcript. And then what I'm going to call this one is the medical note put out by ChatGPT. So it looks pretty good. If you had, I didn't show the complete conversation, it looks pretty good. But there were some errors. So it says BMI here 14.8. Apparently in that conversation, the patient's height was there, but weight was never taken. So they went back and looked at it. So how was the BMI calculated? And so clinicians said, can you check the proposed note and identify any facts that don't appear explicitly in the transcript? And the entire transcript and the medical note is inserted. An output from ChatGPT says the patient's BMI was not revealed as mentioned by the clinician. Interestingly, the patient's BMI happened to be exactly 14.8. So I don't know if it looked at the age and weight loss and made some assumptions. That part is not clear. But once the clinician mentioned the weight, the BMI, actual BMI was actually 14.8. Can you revise the note accordingly? And the output is here as a possible revision. And now it explains BMI 14.8 based on a weight of 87 pounds and a height of 5 feet 5 inches. So this is also good. GPT and other language models are good in fixing errors which are created by AI and by humans. So what all can it do? It can produce notes in various formats, including our traditional SOAP format, can also include appropriate billing codes, and beyond the note, can be prompted to answer questions, extract prior auth information, generate lab and prescription orders, write after visit summaries, and provide critical feedback to clinician and patient. Back office functions. I honestly feel this is where the biggest bang for the buck is. Appointment scheduling. How does it do it? It can interact with patients or staff members, checking availability, booking appointments. It can help reduce the time spent on phone calls and improve scheduling accuracy. Patient inquiries and FAQs. How? Can address common questions such as clinic hours, insurance coverage, prescription refills, test results, and can provide prompt and accurate responses, freeing up staff members' time. EHR management can assist by retrieving specific information from various parts of the EHR, can help locate and present relevant data quickly, lab results, med lists, etc. Billing and insurance inquiries, and referral coordination. ChatGPT can help by assisting in the documentation process, gathering necessary information, and ensuring proper communications. And finally, the internal knowledge base can provide quick access to information related to office policies, procedures, guidelines of frequently used templates, can assist with onboarding new staff members and serve as a reference tool. So you see the quote there. It's important to note ChatGPT can automate certain backups functions, but human oversight and verification is still necessary. Additionally, data privacy and security should be carefully considered. So this quote was by ChatGPT. All right, so what are we doing locally? So AI at CHP. So we have a tool here called ChipView, and kudos to Chris Horvath, faculty in pediatric critical care medicine, Gabriella Butler, who's informatics subject matter expert, and their teams for doing this. So that's expansion of View, which is virtual intelligent early warning, predicting clinical deterioration. It's a intelligence augmentation system that monitors patients, identifies subtle trends, and synthesizes existing data in the EMR into clear, actionable information. This is now implemented across all acute care units in children's here, and is combined with the Watcher program, which our frontline nurses use. There is another AI-based activity at the system level, but before going there, I'm going to show one slide as to how does AI parse out what's called the NLP domains. One example is what's called part of speech tagging. The book is on the table, she will book a flight. It figures out the first book is noun and the second book is a word. The second mechanism is tokenization of word segmentation. So we write in our notes, the dose of amoxicillin is 80 milligrams per kilogram per day. The different tokens are amoxicillin is one token, 80 milligrams per kilogram is another token, and day is another token. Named entity recognition. If the note says Dr. Smith is meeting Dr. Khan in the library, it figures out that Smith's a person, Khan's a person, library is a place. And finally, another tool called stemming, which is grouping words into the root form, infarction, infarcted, infarcting. All of those are categorized under infarct. So this is what we are doing in text analytics at UPMC, just getting started. It's pretty exciting. We're looking at our notes and bucketing them into all these categories: anatomy, demographics, examination, and you can see the rest on the screen. I'll give some examples. So these are real sentences in our notes. He does have itching and rash on his neck and arms. So the itching is a symptom or sign, rash is a symptom or sign, neck is a body structure. UMLS stands for Unified Medical Language System, which is an industry standard. And his back pain improved the next day. So back pain is a symptom or sign, improvement is course, next day is time. It doesn't have to be full sentences. Even if we say something like hemoglobin, greater sign, 9.5 grams per DL, it can parse it out into what's exam name, greater than, less than, equal to, not greater than, equal to. Those fall under relational operator category, the measurement value, and the unit. Healthcare professions, all the consult services. And another example that she was continued on her antibiotics and was afebrile until day number 5. So you see how this works. Every sentence, whether it's a fully worded sentence or a part of it, can be parsed into these validated and defined categories. Another example here, and thanks to Shiv Rao, who is practicing cardiologist at UPMC Presby, and CEO of this Pittsburgh startup called Abridge. And what Abridge does is fairly similar to the example I gave a few minutes ago, when the ambient conversation between the physician and patient is recorded and transferred into a note. So here, the conversation is recorded. What Abridge can also do is to record a telemedicine conversation. If it's a, on the phone audio or video consults that some of you do, the conversation can be recorded. The transcript is produced with important medical mentions are highlighted, and then it can go into any EMR. So won't go into the details, but sort of the same concept. You have all the words, and then the AI is smart enough to pick keywords like breathing, chest tightness, short of breath, lightheadedness, and is also smart enough not to include how was the Steelers game yesterday. Those kinds of icebreaker discussions are taken off in the final note, which looks like this, Mr. President, illness assessment and plan. This can be a game changer. So I have talked to Shiv, who really wants us to trial this at Children's, and we will certainly look to do that. And it tees up the note. The note is not finalized until it is hopefully verified, edited, reviewed, and signed by the attending physician. So what's happening at the national level? AAP is Council on Clinical Information Technology, which I'm privileged to serve as the chair for the committee. We have over 400 pediatricians and informatics interest and expertise from all across the world. And we are starting to work on a policy statement and technical report, realizing that for those of you who work with AAP and other large organization documents, it takes about 2 years to publish that. 2 years is a lifetime in the AI world. So we'll have to keep an eye on how the technology evolves before those reports are published. And I'm also fortunate to be at the table with AAP executive leadership. We met yesterday on what the academy can do to address the harm and benefits to children from these new technologies. I'm certainly talking a lot about the hope, but there is also downsides which could cause harm to children. At the federal level, the policy pace of federal regulation is pretty slow. So this was a communique from the White House just last Friday, where the administration secured voluntary commitment from 7 leading AI companies, Microsoft, Google, Amazon, Meta, et cetera, to manage the risks posed by AI. It's a start. It's not law yet. It's not gone through Congress, but it's a good start. And this was interesting, happened just a few months ago, when US Representative Jake Auchincloss delivered a speech to create an AI center, but he opted to get his speech from ChatGPT. So this 2-paragraph speech was generated, and his staff apparently edited the text a little bit, but this complete brief presentation on the floor of the House was written by ChatGPT. All right, how do our patients feel about it? Right. So Pew Research Center did a study in February and talked to 11,000 US adults. Pretty eye-opening what the results were. 60% of Americans would be uncomfortable with provider relying on AI in their own healthcare. So the first pie chart there, you could see that 60% uncomfortable, 39% comfortable. And as far as will it lead to better health outcomes, it's fairly split. 38% felt better, 33% worse, and 27% would not make that much of a difference. What about bias? Among those who see a problem with bias, based on race or ethnicity, 51% think relying more on AI would make the issue better. So there is hope there. 15% felt it would be worse, and a good 33% felt it would stay the same. So some more data. When you think about the use of AI in health and medicine to do things like diagnose and recommend treatments, do you think it's moving too fast or too slow, the technology? An overwhelming percent felt that the technology is moving too fast. And it didn't matter if they heard a little bit about AI or not. A few more questions here, and you could see, I want to point out the last one, the last row, 57% felt the patient's personal relationship with their healthcare providers would be worse. So this sort of makes sense. AI does a lot of good things. It is not going to give the patient a hug. In our clinics, the AI is not going to high-five the child. So need to keep those in mind. When it comes to diagnostic testing, 65% felt they would definitely or probably want AI to be used in the skin cancer screening. And also the majority, 55%, felt AI would make skin cancer diagnosis more accurate. When asked about pain medications, though, 67%, majority said they do not want AI to determine do they need pain medicine or what should the dose be. When asked about robotic surgery, 59%, the majority said definitely or probably not want it. And for mental health, eye-opening, 80% almost said definitely or probably not want it. So you can see a pattern here. If it's to do with cancer screening and some kind of testing, people generally seem to favor the role of AI. But if it involves pain medications or behavioral health, where you definitely need to develop a relationship with the psychologist or the counselor, folks did not want AI. So even for the AI companies, this is very valuable data to figure out what their priorities and where their investment should be. What are the disappointments? And thanks to Dr. Anthony Chang, who's a pediatric cardiologist at Chalk Children's and sort of an evangelist in the pediatric AI movement here. Lack of early collaboration between data scientists and clinicians. There is still a publication to practice schism, although it is not 17 years. A lot of the studies you saw, the studies were done in the last 6 months, and they are published in JAMA and leading journals. Poor performance of AI-enabled decision support. It is certainly a challenge, especially when you look at kids with complex chronic conditions. It is definitely not, plug and play some of these AI algorithms. The ethics is still underemphasized. Very few business models for AI services. The reimbursement is not any higher when AI tools are used. And even in the EHR, the AI tools are not embedded yet. Quick time check. So this one bothers me. This was in 2017. Stanford algorithm can diagnose pneumonia better than radiologists. It took Stanford AI researchers just a month to beat radiologists at the pneumonia game. All of us know this. There's no game here, right? These are real humans with real conditions. So these kind of clickbait articles, I don't think should happen. And I've been using my opportunities where I'm able to give talks and things like that. I put up this slide and say, this is not how we should move forward. It really doesn't help clinician engagement and collaboration. And these are incredibly smart tech folks, but these kinds of titles for articles really doesn't help. I also feel that we as a healthcare community should partner with these smart tech folks and drive this change and not just be a follower. Otherwise, we run the risk, we as in clinicians run the risk of what happened with medical billing and coding about 30 years ago, and with the widespread adoption of EMRs about 20 years ago, where generally we were the followers. We were not the leaders. It was the technology companies, the EMR vendors who led it. And that has led to significant frustration from the majority of healthcare providers, despite what I and most of us feel with the successes of health information technology. So some publication resources. The New England Journal of Medicine has an AI in Medicine series. These are fairly short articles, 3-4 pages every few weeks. There's one on AI and machine learning in clinical medicine. A lot of the material I took was from the GPT-4 Patrick Lee's article, using AI to interpret medical images, advances in AI for infectious disease surveillance. You would probably find an AI-based article for any medical field that you want to look up. Or you want to look up something for colonoscopy or cystic fibrosis and things like that. So there are lots of fairly narrow projects looking at various clinical conditions. And the NEJM is also coming up with a new AI journal. They have a Grand Rounds podcast. And a lot of these scientists, at least in industry, are fairly prominent on Twitter. So the Twitter feeds is also a good source of information. As far as textbook resources, I would suggest Intelligence-Based Medicine by Anthony Chang, who's a Pitt's cardiologist. And Stephen Wolfram, what is ChatGPT doing and why does it work? It's fairly technical. And Artificial Intelligence, a guide for thinking humans, as opposed to non-thinking humans, I guess, by Melanie Mitchell. So I'm going to deviate a little bit and just show two non-healthcare applications. So this is an application of AI in home tech. There's a Japanese AI device that reads stories to your kid with your voice, even though you have never actually read that story. So how does it work? So there's a smartphone app. You register your voice by reading a sample text passage, probably about 4 or 5 paragraphs. AI then synthesizes the voice, matches the inflection and intonation to provide proper emotion to the stories it tells, and plays through the speakers of this egg-shaped device that you see. It's like a big Bluetooth speaker. It's preloaded with 45 stories, including, I had to write this down, Little Red Riding Hood and the 3 Little Pigs. It's there. Interesting part is multiple voices can be registered. So on the same app, on the same phone, you can have, grandma's voice and grandpa's voice and auntie's voice, so that grandpa can read Little Red Riding Hood and grandma can, narrate Three Little Pigs. Keep in mind, they have actually not read the whole book, but the sample passage picks up keywords, intonations, pauses, the highs and lows of normal conversation. So what is Google up to in this field? How Google trains its AI-powered medical language model. Google worked with clinicians in 3 different countries, and their equivalent of ChatGPT is called MedPalm 2 to produce answers. It had the clinicians answer some questions, not so much for content, but for style, and sort of train the model to think like to clinicians. And this is not publicly available, but was found to have 85% accuracy when it came to answering medical licensing exam questions, which is higher than what the study published with ChatGPT, which I think was 68 or 70% for the USMLE questions. And there is a list of board and certification exams that these large language models have passed, and a much smaller list of exams where these models have failed. New job description for a prompt engineer. Why Boston Children's is hiring an in-house ChatGPT expert, John Brownstein, who's the Chief Innovation Officer. We talked about this technology called prompt engineering. It's more important with Google searches. Sometimes you can get the right search depending on how you put in the keyword or whether you click on images or go to YouTube, etc. With ChatGPT is really important that I got slightly different answers for the Excel and Desi's article because I may not have used the word summary or conclude. So that's where the prompt engineers come into play, and not just about keyword search. What are the use case scenario? And John talks about it here. This person will be part of their digital health accelerator team. AI can do a lot. It's overwhelming. There could be scope creep. So the ask for this person would be, what are we going to do to help our, clinicians and patients, and to sort of narrow the focus. What are our local resources? Pitt, through the University Center for Teaching and Learning, has a dedicated website. It's pretty good. It's called ChatGPT Resources for Faculty. And it talks about what can these tools do, what are the limitations of these tools, what are some opportunities to use it in our own teaching, and what about detecting work done with generative AI like ChatGPT? This is tricky. There is a tool, I think it's called Turnitin, which tries to figure out whether a student's assignment was human generated or AI generated. 98%, 99% accuracy rate, I think, but also false positives. It picked up some of the content as AI generated when it was actually generated by the human student. That's another problem, right? So that's why in this page, the Pitt folks will actually tell you they're not overtly endorsing Turnitin, but it is there to be used. And also, what can we do to encourage academic integrity? I'll finish off with just a few slides here. Grant funding for AI in medicine. Kaiser has a division of research, which is starting a fund here to use AI and ML in the practical world. And I just missed the deadline. I really wanted us to submit. I think the letter of intent was due June 30, but more of these will start to come. NIH has a program called Bridge to AI, which aims to enhance artificial use in healthcare. And at least one of the earlier projects funded is for 2 University of Virginia researchers who will explore ways to improve the AI application with a wider diversity. A lot of the data sets have bias built into them. And Stanford has some seed funding too, although I think that's only for their faculty, but we could certainly collaborate with them. A couple of other slides to finish up. Epic and Microsoft and hospital systems. This is interesting. So Epic and Microsoft are collaborating to combine the Azure OpenAI service with the Epic software with an initial focus on drafting message responses. This rollout has already begun. About 10 physicians in UNC Health in North Carolina are using it to auto-draft responses to some of the most common and time-intensive patient messages. And a couple of other hospitals are also part of this early trial. AI doing good deeds. I want to give 2 quick examples, which is not in healthcare, but very interesting. Has anyone here heard of Be My Eyes? So it has been there for a while. It is creating technology for a community of over 250 million people who are blind or have low vision. What GPT-4 has done or can do, this is still in the research stage, is collaborating with this and developing a virtual volunteer through the app so that the app can generate the same level of context and understanding as a human volunteer. I think they're trying to guide the person who is having low vision through an airport, those kinds of things. So they don't necessarily need a human volunteer. And the last example, most of you would have heard of, Khan Labs and Sal Khan. And in this case, Khan Migo, which is in beta, works very much like a real life or online tutor, looking at students' work, especially in math and computer science, and also tells the student where they have gone wrong. So this is a real interaction, pretty interesting, where the student says, can you just tell me the answer? It's important to learn how to do this. What do you think you need to do to multiply 2 by 5 by 12? They need the same denominator, and it explains, and what else would you try? This is a machine doing it, taking the role of an online tutor. And thanks to Kavita for sending me this little graphic. Are you concerned about the increase in artificial intelligence? No, I'm concerned about the decrease in real intelligence. I mean, the humor in this is well taken, but I also feel that it's not a zero-sum game. If my intelligence is going down, that's probably the natural aging process. I shouldn't be blaming, AI for that. There are lots of good uses. Conclusions. AI and technologies are here to stay. Machines do not have the downsides of human nature that clinicians face. The machine is probably not going to get tired at the end of a long 9-hour ER shift or an ICU shift. Collaboration amongst clinicians and between clinicians and technologists is very important. Bill Gates quote, we always overestimate the change that will occur in the next 2 years and underestimate the change that will occur in the next 10. I still feel the best medical technology of all time is the stethoscope, because it literally takes me closer to the patient. And there's been a lot of discussion about radiologists and dermatologists, to mention two fields, losing their jobs. It absolutely has not happened. We have more radiologists and dermatologists today than what we had 5 years ago. Should that be at the cost of primary care physicians? That's a different discussion. But I do not think that I will be replaced by a machine or a computer or a robot, but it's very possible that I may be replaced by a clinician who has a better understanding of these technologies. Finishing off with two of my best quotes. If you can measure it, you can manage it. If you can automate it, it's really difficult to improve. That's the great promise of AI. Last slide. In God we trust. Everyone else must bring data. Thank you.